just wanted to focus on some issues relating to health, because particularly in health and particularly in the environment, the challenging environment that we face in maintaining and delivering a world-class health service for the people of Western Australia, there are a number of areas where cooperation with the federal government is imperative. And I just wanted to start with a brilliant forum that I was fortunate enough to be at last night in my capacity as representing the Minister for Health, and it was held by the WA chapter of the Royal Australian College of General Practitioners, the RACGP, and the chair of the college, the president of the college at the moment. Is Dr. Ramya Raman, and I think a few people in this chamber have probably met Dr. Raman. And in order to deal with primary care and the provision of primary care and the promotion of general practice as a field of endeavour for medical students, Dr. Raman and the RACGP had got together various stakeholders, federal members of parliament, state members of parliament, university deans of the medical schools, RACGP fellows, consultants and medical students, to talk about how we can facilitate and advance and encourage more students to get into general practice. And the state government was there. I was there. Primary care, on a strict construction, is the responsibility of the federal government. And one of the consultant physicians who was at the same table, we did classic workshop, round tables, butcher's paper, all the rest of it, the stuff that gives some of us nightmares. But one of the clinicians who was sharing the table with me said one of the greatest damages, one of the most significant acts damaging general practice was actually committed by John Howard in 1996 when he removed provider numbers for general practitioners, and he said this. I'm not going to tell you who it was because I didn't speak to him. I didn't speak to him about this, but he said that act from 25 years ago is still the single most significant act undermining the provision of primary care in the health system nationwide. But the RACGP quite appropriately identified the international context, and I just want to make sure that I represent the position correctly. So I'm just quoting from the presentation that Dr. Raman did. To contextualise the event, they talked about the international context. They talked about strengthening primary healthcare has become a key strategy for health systems to respond effectively to ageing population, increasing health inequalities, growing numbers of chronically ill patients, and thus to an increasing demand for healthcare services. International comparative studies have shown that health systems with strong primary healthcare achieve not only better health outcomes, but also better results in equal access to care and cost containment, and to achieve optimal balance between supply and demand of health professionals, development of clear pipelines into general practice, multifactorial support for key elements of the medical training journey, coordination of all efforts predominantly towards primary healthcare with prioritisation and workforce planning pivotal. So that's the sentiment that was expressed last night by the RACGP. We couldn't agree more. We couldn't agree more, because it's imperative that the healthcare system is functioning efficiently and effectively between the state and federal levels. And so we are working, so the point is this: we are working collaboratively with stakeholders, with the universities, with students and with the RACGP to identify what we can do to facilitate and promote greater access to primary care and for people to participate in primary care. One of the things that we can do, and one of the things that we're working on, in fact, is placements for students in GP clinics and in GP practices. And I'm glad that the member for Central Wheatbelt is here, because there was a brilliant presentation that was made last night by Dr. Phoebe Blacksell. Dr. Phoebe is the I don't know if she's a doctor yet, but last year she was the RACGP WA Student Council rep, and her presentation was all about the importance of clinical placements for general practitioners on their pathway to general practice. And she said that her clinical placement experience, her favourite clinical placement experience, was the rural and regional clinical placement experience. She said that more doctors, more of her cohort, have an interest in and a desire to work regionally and rurally as a result of the experience that they've had on the rural and regional clinical placement. Now, I know that this is an issue that the member for Central Wheatbelt has raised, because you've got these small towns where the provision of primary care services is imperative. It is imperative. You need proper funding, proper resourcing, and so one of my great frustrations, and I don't know why they continue to do it, but one of my great frustrations with the National Party is they continue to support, they know that we need primary care physicians in these little country towns, and they know that the funding for that needs to be provided by the federal government, and yet they sit idly by, in complicity, as the federal Liberal government time and again attacks Medicare and attacks primary care, cuts the funding and undermines the provision of primary care physicians and so the Labor Party comes along, federal Labor and state Labor. We're desperately trying to find what we can do, what levers we can pull, what changes we can make in order to try and encourage more people from the regions to both study medicine, but then also to return not as specialists, but as general practitioners who are the cornerstone of a well-functioning health system, for the reasons that the RACGP outlined last night and for reasons that I agree with. So that's